This presentation is on the Dun Global Adderall fraud. This group is Amelia Garibaldi, Alexandra Casados, Elizabeth Pena, and Jacqueline Fabian. So, who was involved? The CEO of Dun Global, which is a telehealth company, um, Ruthia He and Dr. David Brody have been convicted by a federal jury in San Francisco. Federal investigators involved the U.S. Department of Justice, Drug Enforcement Administration, and the U.S. Department of Health and Human Services. This occurred nationwide as it is a telehealth service, but it's based in San Francisco, and it mainly operated in COVID-19 between 2020 and 2024. And then the executives were arrested in June 2024, and a federal jury convicted them in November of 2025. So, what happened? Um, so, Dun Global is a telehealth company, and they charge a monthly fee for a subscription for Adderall. They provided online diagnosis, treatment, and refills of medication that were supposed to be for ADHD. Um, but members were issued prescriptions for Adderall for not a legitimate medical purpose. So the company also conspired with another company called Mindful Mental Wellness, and this is how they ordered drugs for the Dun subscribers. Um, and these patients lacked examination, they lacked a practitioner-patient relationship, and the only examination a lot of patients had were just short video communications. So uh, he and Dunn spent over $40 million on advertisements that were deceptive during COVID-19, and they were just trying to convince people that they had ADHD so that they would subscribe um, to Dunn Global. And a lot of prescriptions were on an auto refill subscription where patients would just receive the same prescription monthly without any clinical interaction for long periods of time. And it actually, in an article, it stated that um, the auto refill feature led to some people that were deceased were still receiving um, refills of their Adderall prescriptions because they were just on an auto refill feature, and they were never being checked up on. He and Brody also submitted fraudulent requests to insurers that claimed that um, that Dunn was following the correct medical procedures for administering drugs, um, which led to Medicare and Medicaid paying extra money in insurance. So they were also kind of investigated in 2022, and they tried to hide evidence um, from the Department of Justice, which led to them being convicted for obstruction of justice as well. So the laws and regulations that are involved in this case are the Controlled Substance Act. Um, The Controlled Substance Act regulates the manufacturing, importation, possession of and use of certain drugs, certain substances. This includes Adderall. Um, and the healthcare fraud statute. This prohibits um, knowingly and willfully submitting false claims to insurers, which they did. Um, the False Claims Act, which prohibits submitting false claims for government reimbursement, and the obstruction of justice, which prohibits interfering with an investigation, um, which the executives were also accused of destroying communications and records. Um,
The key legal elements, this is a criminal case, so executives and doctors have been charged with crimes such as drug distribution, fraud, conspiracy, and obstruction. The minimal aspects of civil case, it's a False Claims Act. The Dumb Global case is being handled by federal authorities. It's a healthcare fraud, billing, submitting false claims, distributing prescriptions. It's also money laundering, concealing proceeds of illegal activity to make appear legitimate, fraudulent misrepresentation, deceiving individuals about the nature of Adderall, counterfeiting drug regulation violation, distributing or manufacturing counterfeit Adderall, as well as trafficking across borders illegally without proper license, internal law violation, violating agreements related to drug control. The legal outcome, Ruthia He and David Brody were arrested in the summer of 2024. Dun Global has been convicted in an $100 million Adderall distribution and healthcare fraud scheme. The founder, Ruthie He, and former clinical president David Brody were found guilty on account of conspiracy to distribution a controlled substance, 4 counts of distribution of controlled substance, 8 count for conspiracy to commit health care fraud. He was found guilty of the additional count of obstruction of justice. Sentencing is set for February 25th, 2026, facing a maximum penalty of 20 years in prison. Other legal consequences for the company are still undecided.
This slide is titled Ethical and Policy Implications. Here we're going to go over the ways that they didn't follow ethical ways. The first one is unethical prescribing practices. These two providers prescribed Adderall without an actual legitimate medical purpose, as mentioned earlier. They didn't need any paperwork or pretty much any information in order to get this Adderall. Next, we have profit versus patient care. This company done prioritize their own profit over patient safety by simply disregarding their medical history and just, again, giving them medication just like that. They gave out over $100 million worth of medication in the span of about 2 years. They also exploited telehealth policies. They took advantage of this time during COVID and all of the emergency policies that were barely getting brought up. They took this time to allow prescribing medication without in-person visits or without any consultation appointments. They provided deceptive marketing and patient manipulation. They used misleading propaganda, misleading photos, and misleading information just to get people to adhere to the subscription that they were offering. The public health consequences was that it worsened the Adderall shortage for those that actually need it. It contributed to stimulant misuse and addiction crisis. So there was even people that were taking Adderall and self-diagnosing themselves when they didn't even have ADHD. So that, in my opinion, was a negative consequence for the public health. And there's also regulatory gaps and policy challenges that came out of this situation. They submitted false claims since they submitted false claims to the insurance, there was a quote that I found from Landy. It says, as a result, Medicare, Medicaid, and the commercial insurers paid in excess of approximately $14 million. This was just a direct quote to reinstate what was said earlier. And also trust in the healthcare system. They really played with the trust between the public and the healthcare providers that we have. And it emphasizes the need that we really do need ethical standards in place just to make sure that people are doing their job. Some broader implications for healthcare organizations in general was that it increased scrutiny on the telehealth controlled substance and the way that they prescribe medication. This was pretty much the first criminal case regarding improper release of a drug directly through telehealth or aka an online service. There was a quote that I found from Porter 2025 says, "Aims to unlawfully provide ED online access to Adderall and other stimulants by targeting drug seekers engaging in deceptive advertising and putting profits of a patient care." This just proves that it was all done on purpose and all for profit. Another impact on the patients was that by getting caught, they had to immediately stop this company that they had brought up. And so therefore there was an immediate fallout causing a lot of disruption of patients that were actually using it. And it was estimated that there was around 30,000 to 50,000 patients that were negatively affected by their company. Pharmacy relations include just how wide the gap is between telehealth providers and pharmaceutical companies, and that there's really no, or at the time, there was really no communication between the two, and that it was really all about money.
Some lessons learned or some issues that could have been done to prevent the issues is by consumers to be able to recognize the difference between genuine services and too good to be true. Also, the demand for Black market alternatives and encourage informed decisions making. Also, that across verifying patient data for doctors, shopping applications, and all AI to identify the high risk requests pending manual review temporarily. Another thing would be the real practitioners should screen each prescription, particularly for control or high risk medications. This slide is about risk management. Global advertisement, which it is to provide online diagnosis, treatment, and refills of medications for attention deficiency and hyperactivity disorder. Another thing would be global and MMW. They order Adderall and other stimulants for DUN members, including Medicare and Medicaid. In 2023, certain pharmacies, they started to refuse to fill prescriptions that are written in prescribers that are retained by DUN Health. Global faces as a maximum penalty for conspiracy and illegal distribution if Adderall of twice the gross profits. Also, allegedly conspired to submit false and fraudulent claims to Medicare, Medicaid, and to commercial insurers. Another risk management will be that illegal distribution of Adderall of twice the gross profits or either proceeds. The impact on patient care. Some pharmacies refuse to refill their prescription. That only happens when the prescription is coming from telehealth appointments. Another impact will be that patients would sometimes receive counterfeit medication, and those can be dangerous to the patient. And when patients switch providers, it can be hard for the new doctor to prescribe the medication due to they don't want the patient to continue with the prescription of stimulant therapies. Patient can also be a risk of untreated ADHD, which this happens with social/emotional, which can be done with high-risk behaviors.
And these are our references.